everybody. Welcome back to another episode of Hybrid Healing Hour. Today we are having our friend and colleague and a local cardiologist with us today, Dr. Barry Merrill, and we're going to be discussing heart failure. I'm super excited to have you on to our show. Can you please tell our audience a little bit about yourself and how you got to where you are today?
Sure. Thanks, guys. So glad to be here, and thanks for having me. My name is Dr. Barry Merrill. I'm actually Chief of Cardiology over at Boca Raton Regional Hospital and Director of the Cardiac Catheterization Lab. Over there is where I've been here in the Boca Raton area for about 23 years practicing cardiology. And so that's a little bit about myself. I'm originally from Washington, D.C., but like I said, I've been down here for 23 years, which I guess makes you practically local here.
Everyone's from somewhere else, I feel.
I've known Barry a long time. In fact, we trained together at Tulane in New Orleans. Barry was my intern when I was a resident, and look at how far he's come in life.
Yes, and Brian must have had a lot of confidence in me because the very first day at work, 20 minutes into the day, he had to go run an errand and left me there by myself. It's been downhill since.
It was sink or swim, right? Well, good. So I'm really excited to talk about heart failure today. I feel this is something that is probably under diagnosed or not caught soon enough frequently with patients out there. And so I just want to educate our audience today with this. And
a lot of people just don't understand heart failure. They think heart failure means your heart just stops, right? And that's not what it means.
Yeah, there's definitely a tremendous fear factor when someone's told they have heart failure. So, I mean, heart failure is sort of a large phrase for a whole different range of diagnoses and problems.
Okay. So why don't you tell us exactly, what is heart failure? How does it differ from, a heart attack? And there's different classes of heart failure, right?
Sure. So, heart failure essentially means that you're having trouble either breathing, having pains in your chest, or having swelling in the feet or the ankles from excess fluid that's winding up in the lungs and other parts of the body. And that can come from a wide range of causes. And there are two sort of main types of heart failure. One is systolic heart failure, which means that the heart is actually weakened, and then there's diastolic heart failure, where the heart's squeezing normally, but it's actually stiff and can't handle excess fluid or salt. And so when you expose yourself to too much salt, go out, eat something you're probably not supposed to be eating, you'll end up feeling, for lack of a better way of putting it, kind of crappy from doing that.
Right.
And, suffer for it briefly. This is completely different from a heart attack. Heart attack has to do with the heart arteries. That's when one of your heart arteries actually blocks up suddenly and causes the heart to stop beating suddenly and can put you at risk for the heart either failing, not being able to pump, or causing life-threatening irregular heart rhythms. So completely different than heart failure.
And then this isn't something that, well, I guess correct me if I'm wrong, is this something that can traditionally happen overnight, or is this, does heart failure develop over time?
Heart failure can happen acutely, but for certain things, like a heart attack can cause sudden heart failure. Like if you're having a heart attack, your heart's not beating as well. Fluid can back up suddenly into your lungs. In those situations when it happens suddenly, usually it's something that's very obvious and causes us to look for other causes. More historically, other kinds of heart failure kind of are slow or indolent or build up kind of insidiously and kind of sneak up on people. They might notice a little bit of puffiness in their feet, like they're just not able to do things quite as well, getting a little bit more out of breath, like they're not exercising as well. Say they have to stop if they're walking in with groceries or kind of routine day-to-day things, and that kind of sneaks up on them, especially, the first time or a couple of times people have these symptoms, they're kind of caught unawares and don't really make the connection that it could be, a heart problem as opposed to just being tired or, fatigued or, some people even write it off just to getting older.
Exactly. I hear that all the time. I'm assuming I'm just getting older, and I'm like, what? I actually hate that phrase. Like, I want to figure this out more than anything.
So we talked about the two different types, the systolic and diastolic. Is one more common than the other?
Well, it's interesting. They're both actually incredibly common problems. It's probably, one of the top 3 diagnoses that people are, admitted to the hospital with, and more importantly, like readmitted to the hospital with, if and when it's not like recognized or treated as aggressively as it needs to be. So it's actually a very prevalent problem out there, and that's why we're sitting here talking about it, to help people kind of recognize, understand this, and then hopefully find their way to getting treated properly for it. Going back to what you were saying, systolic heart failure means that your heart is weakened for any number of reasons that could be. The most common cause of the heart being weakened is actually damage to the heart from blocked arteries, either incomplete blockages cause the heart to can cause the heart to weaken slowly, or a heart attack which permanently damages the heart and weakens it. And that's probably the number one cause of the heart being weakened. But there are quite literally hundreds of things that can cause the heart to weaken.
Yeah.
Can like somebody have acute heart failure when they might go into the hospital and they might have like pneumonia?
Viral infections.
Or a viral infection.
Certain viral infections can cause, it's actually more of an immune-mediated response where the body actually will start to, attack the heart or weaken the heart. The most, recent one that people know about is like COVID.
Right.
Where that can actually cause heart damage. Although it's actually not really the virus itself per se, it's actually the body's response to the virus, and then confusing the heart muscle with the virus being expressed on the heart muscle and actually causing damage to the muscle, sometimes transiently, sometimes permanently.
And alcohol can do it too, right?
Alcohol can do it, certain like heavy metal toxins, sarcoidosis. There are a lot of things that can happen to the heart muscle. Probably more things than are beyond the scope of what we could cover in an hour.
Yeah.
Exactly.
That took me about 11 years after medical school
to see everything.
Go to college to learn all that. So
right.
And
I don't think we
then
can squeeze it in an hour.
something that we commonly see in our practice is hypertension. Hypertension has all sorts of repercussions. But
right. So hypertension can actually, over time, weaken the heart. The other thing it can do is it can cause the heart to thicken over time and become stiff. And so that's the second kind of heart failure that we talked about, which is diastolic heart failure, which means that the heart becomes sort of stiff, or we say non-compliant, and that you're less able to handle shifts in fluid or salt balance. And so, like say you take in too much salt, like go out and eat Chinese food. That's a common one that people always use, although there's plenty of things that have salt in it. That, a lot of it actually unrecognized even by people. And then, that excess salt actually pulls or keeps water in the body. It's not really the water per se, it's actually the extra salt that's keeping excess water in the body, and then that will go and sit in places like the legs and ultimately start filling in at the lungs, causing a sensation of difficulty breathing.
So one of the things that we use to measure heart failure and heart function is the ejection fraction, right? And that's done through an echocardiogram, but there's other ways to do it too.
Right.
So do you want to explain to people, because if someone gets an echocardiogram, they'll look at the report and they don't understand, when it says 60%, that's actually doesn't, it's not like getting a grade in school where it's 60%.
Right. That's not a failing grade. Actually, because if you think about it, heart's, it's sort of like a tube or cylinder, it's squeezing, but it's not squeezing all the blood out with each beat. It's squeezing about 60 to 65% of the blood out is normal. And as that, number starts to go down, that, can be an indication of one of those other, situations we talked about where there's something is causing the heart to weaken or damage. But, 60% is normal. I'm sure the number of times that you or I have had someone call in a panic reading their own reports.
Right.
That's a problem with interpreting
Yeah.
your own results. So where would you be concerned? What's a ejection fraction where you start to say, well, maybe there's a problem?
I mean, even down to 55% is below normal. So once you hit about 50% or below, that's indication that there's, something brewing there.
Right. Okay. Now, is there a difference between like right-sided heart failure and left-sided heart failure?
Sure. Well, I mean, the heart actually has two jobs. The left side of the heart pumps blood out to your body. The right side of your heart actually is pumping blood through your lungs to get oxygen, which then goes to the left side of your heart and gets distributed to the rest of your body. So you can have problems with either side of the heart. Most of the treatments that we're going to talk about or think about are related to left heart failure, but you can have weakening of the right side of the heart as well. And that usually relates specifically to pulmonary conditions, things that cause the blood pressure in the lungs to go up. Different kinds of breathing problems can put strain on that side of the heart. And that's actually probably more difficult for us to treat, or at least the medications we have right now aren't targeted to that.
They're more specific to the right side.
To the left side.
To the left side of heart failure, right.
Right, left.
Yeah, correct, I should say.
So, although the most common cause of right-sided heart failure is actually left-sided heart failure, which means that the blood's backed up and putting stress on the right side. But, different kinds of lung problems can cause that as well.
Okay.
And then there's classifications of heart failure, right? And it's the New York
Heart Association.
Yeah.
Is like the classic classification system. And there are actually 4 levels of heart failure in the New York Heart Association classification system. Class 1 is actually when people are relatively asymptomatic, but for whatever reason the heart might be mildly weakened and people are actually unaware. That's actually both the easiest point to intercede and hopefully potentially reverse, but also in some ways the hardest to pick up because people don't really have symptoms. And then it kind of grades from there, where class 2 is to have mild symptoms in conjunction with the weakening of the heart. Class 3 is more severe symptoms, or getting symptoms with routine daily activities would be sort of our benchmark for that, as opposed to moderate or higher levels of exertion. And then class 4 is really symptoms at rest. Class 4 is really the most severe, where, the heart or the pump, so to speak, is starting to fail. And that's, at that point, class 4 is almost too far gone. And that's when you're talking about, therapies where you actually have to mechanically support the heart, or, even, go so far as to do a heart transplant.
Okay. And then, we talked about some causes of heart failure, such as infection or longstanding hypertension, and some other chronic diseases. I'm sure like longstanding anemia probably could too. Or, but what about like some other ones that we see? And I think there's people who don't understand the repercussions of like just diabetes and kidney disease. Mm-hmm. Actually, we've mentioned before that people don't typically die from, the kidney disease or the diabetes per se. They actually end up having heart issues.
Right. They die from the complications of that.
Exactly.
So, I mean, it's all in sort of how you look at it. Like, like diabetes, the kidneys, and the heart all kind of work in unison. So, if one's not doing its job properly, the others are having to pick up the slack and ultimately being taxed and damaged, over time. But yeah, like I said, people with diabetes, the most common way of dying is from a heart attack, different than heart failure. But, when people's kidneys weaken, they have more propensity to fill up with fluid and have heart failure symptoms. The ultimate manifestation of that being, the kidneys failing completely and needing like dialysis, something like that.
We're also very big on screening for sleep apnea. Is there an association with sleep apnea and heart failure?
So there is. The sleep apnea actually causes a whole variety of symptoms, aside from just making you feel kind of foggy and not able to concentrate and fall asleep at the drop of a hat, it actually puts strain on the right side of the heart. So if you think about it, what's happening with sleep apnea is that you're actually basically choking yourself or cutting off your oxygen level for periods of time while you're sleeping. Your oxygen level drops down. Your body needs this oxygen to survive. So your body's first response is to actually decrease your metabolism, so you're not burning as much oxygen. So that's part of why you feel fatigued. But that also makes it more easy to gain weight, harder to lose weight. Just have less energy in general. It also makes you tend to retain sodium, makes your blood pressure more difficult to control. That actually ultimately puts strain on the right side of the heart, which can cause like that high blood pressure we talked about in the right side of the heart, which can be more difficult to treat without treating the sleep apnea. And then it actually can predispose you to irregular heart rhythms. The most common thing be atrial fibrillation. That's like a whole other hour discussion.
Yeah, we'll have to have you back on for that.
Minimum. And then, or even life-threatening arrhythmias that, can kill you. So.
Right. So, and we did a brief podcast on sleep apnea, and you should go back and take a listen to that because, as you said, there's a lot of repercussions with not treating that. And this kind of goes hand in hand with like the quality of life of somebody. Like when somebody has heart failure, you've already mentioned they can feel extremely run down, fatigue. They can have swelling in their legs and their hands, like extremities. They can have a cough, maybe a persistent cough. They can get swelling in their abdomen even, and shortness of breath, right? So, to me, that does not sound fun to be walking around struggling like that when you can't even make it from your car to inside the store or bring in groceries, like you said. Is there anything else that somebody should be aware of, like symptoms of heart failure that you see in your office, or how you can give an example of how quality of life has been living with heart failure?
That's a pretty good rundown.
Okay. How did I know you were going to say that?
Yeah. So, anything else I can think of specifically? No, like I said, that's sort of why people come in and, get their visit.
Yeah.
Because, what you're doing when, people come in for an appointment, they tell you everything's great. And then, the whole point of them being there is to try and talk to them and actually, people sometimes ask the same question over and over again, but it's interesting. Sometimes people answer the same question 3 times before they actually get to the true answer.
Yeah.
Absolutely.
Yeah, because, they're even unaware sometimes of how maybe they're unconsciously limiting themselves or not doing as much.
Right. Especially if it's been like a slow progress over a year or so, you might not realize.
Right.
So it's how we can, as clinicians, how we can ask the patients about their progress.
And that's one of the important reasons why you should be getting examined by a doctor, because there's things doctors look for as well, like bulging of the veins in the neck. Right? That's
you mean like just a general practitioner, or like
right.
your general doctor too, right?
Yeah, they feel your legs and see if there's any swelling. There's a lot of signs and symptoms.
Right. So even though, say, this stuff will sneak up on you, there's a lot of clues to what's happening. But, as a regular person, they might not be things that you're attuned to.
Right.
So that's why, following up with your doctor or physician's assistant is important.
Exactly. I was going to say, you better say that right now. So why don't you tell us, is an echocardiogram the image of choice to diagnosis, or how can heart failure all be diagnosed?
The heart echocardiogram, which is like an ultrasound test, so there's no X-ray or radiation, which some people have concerns about with some of the imaging or tests. So it's very innocuous, benign. It's relatively quick and easy. It's about a 15-minute test. It uses ultrasound waves to actually take pictures of your heart, sort of like the same thing they use when they're like looking at a baby or something like that.
Right, and a pregnant female.
Right.
Mm-hmm.
So if it's safe for that, it's probably pretty safe for you too.
Yes.
So we can get a picture of your heart squeezing, and we can actually also get a view of how quickly the blood's like moving through your heart and across the heart valves, and which direction it's moving. We can make sure it's going in the right direction. We can see if the heart valves are leaking. As you get older, the natural history of everything is it kind of gets worse.
Right. Even heart valves can get stiff or leaky. Or,
right, the heart valves can get stiff and begin to, either block up or leak. And that also can contribute to, stress or weakening of the heart over time. So the echocardiogram is kind of the best, like, first or baseline test to, get a look, see what that number or percentage of squeezing is. And there are ways of calculating that. I mean, the most common is just looking at it visually. And, I've looked at probably 30 or 40,000 echocardiograms over the last 20 years. So, I mean, you get an idea after a while. But, I mean, there are other measures of, like, objectively measuring, how it's actually squeezing. Won't get too into that, but there are ways where they can measure the volumes of the heart and get, some idea of how well it's squeezing.
That one's the least invasive, I would
Correct.
say, right?
That's like the best screening kind of way to
I mean,
measure
sometimes
that.
it can be seen on just a regular chest x-ray by chance, right?
Right. I mean, it could be suggested by that. They can, as long as, like, you're talking about good technique, like you're going back to front, things like that.
Like if the heart looks enlarged on the shadowing.
Right, that it'll look larger than it's supposed to. That could be a clue.
Right, but ultimately go then do the echocardiogram. Right. Okay.
And there's even some blood tests that can indicate heart failure too, right? Like the NT-proBNP.
Correct. So, it's not, the most specific test in the world, but, it's also a good clue of, how much sort of fluid or you have in your body. That's, so that's a blood test that can actually tell you how much fluid you have and kind of give us some clue as to where you're at in that spectrum of excess fluid or retaining fluid.
Right. Okay.
So can heart failure be reversed? Is it a permanent condition?
Or does it depend on the stage?
Well, it depends on, sort of what caused it, what's the stage. With the appropriate medication for the appropriate thing, it can be, I think of it as more as once you've had problems with heart failure, it's a problem that you have the potential to have and that you need to be sort of on the right medications, be followed appropriately because it can be managed and can be maintained and not have symptoms. But, if you neglect your medical care, don't take your medications, don't eat the proper foods, don't, be cognizant of your salt intake, that all those things are going to, contribute to you're having more and more problems with it. I mean, that being said, being told that you've had an episode of heart failure isn't a death sentence by any, measure, estimation, which, some people, once you've told them that they've had heart failure, go into a spiral or panic, which, is not necessarily warranted.
But if it's enough to light a fire under their butt to get started and maybe change their lifestyles, to follow a low sodium diet, to get exercising, increase their cardio capacity, lose some weight to alleviate any excess pressure on their other organs. Like, is this something that if they had one incident, their ejection fraction was, say, 40%, well, I don't know if that changes the stage, but I would say even if it was mild, say they go on medications for the time being until they can improve all their quality of life. Is that something they would be able to get off medications? Possibly.
It depends whether it's like the systolic heart failure, whether the heart's weakened, and then certain conditions, the heart's weakened temporarily, like say from like autoimmune or viral conditions or something, like some sort of infiltrative problems like sarcoidosis. Theoretically, the heart, you treat the underlying conditions, heart can strengthen and get back to at least a better state, hopefully normal, but there's no guarantee of that. And it becomes the question is, are you trying to make the heart squeezing number normal, or are you trying to make the person feel normal?
Right.
Which, I always tailor, what I'm doing to making someone feel better.
Yeah.
I think that's like, sometimes lose sight of the fact that's really our first job is like doctors, just make people feel better.
And we don't always treat the numbers.
Right.
Exactly. Okay. Thank you for clearing that up. And so I guess, is there anything that people could work towards to prevent having heart failure or prevent an episode or chronic changes other than maintaining their blood pressure, preventing diabetes, trying to not get sick or have autoimmune conditions? Like anything else, like words of advice or tips?
No, it's inevitable. No, I'm just kidding.
Now they're really scared.
No, I mean, all the things that you sort of alluded to, like just being aware of your lifestyle, like, inactivity. There's been some studies over the last 4 or 5 years that suggest that inactivity is nearly as bad for you as smoking.
Right. Exactly.
So, finding a way to get your 20, 30 minutes of activity at least 3 to 5 days a week, doing something. And, people get hung up on the idea of like going to a gym is the only thing that they can do.
Right.
Whether it's going out for a walk for 20 minutes
just have to
after
move.
dinner, going on a bicycle ride perhaps.
I always say something is better than nothing.
Right.
Yeah.
So, even going out, gardening, doing work around the house. I mean,
And we
golf,
can't
sort of.
we can't
Yeah,
emphasize
exactly.
strongly enough that controlling your blood pressure is important. We have a podcast on reversing hypertension, which I recommend people listen to, but I think that too many people don't take blood pressure elevation seriously enough, and they really should.
Hence the name, the silent killer.
Exactly.
Exactly.
Although that was coined like 1970, something like that.
And
I think that was like an ad campaign back then. But it still
It's
holds
still
true
pertinent,
today.
exactly.
Because plenty of people, some people say they know when their blood pressure is elevated because they have a headache. And, quite honestly, probably 80, 90% of people have no idea if their blood pressure is high or low. And, that's part of why you need to go for your routine checks to get checked, check and make sure that that's not creeping up on you. Because, quite honestly, it kind of starts sneaking in there around the age of like 40 or so. That starts slowly becoming a problem. Between 40 and 60, it might just kind of sneak in there, and it might have been normal for many years, and then it starts to get higher, and then the next thing you know, you have high blood pressure you're not treating, and that can lead to a host of other problems, like with your heart, your kidneys, eyes.
Exactly. Yep.
So how do we treat how do we treat heart failure?
How do we treat heart failure? Well, again, it depends partly on whether it's due to a weakened heart or a stiff heart. Like I said, for a weakened heart, we actually have a very good handle on the kinds of treatments that there are for that. There are 4 major classes of medications that we use for that. One is a beta blocker, which is a medication that lowers your blood pressure and actually slows down the heart rate. It's interesting because for a long time that was considered sort of counterintuitive. Your heart's weakened. Why would you give a pill that weakens your heart?
I think when we were in medical school, that was not used for heart failure.
That was like just starting to come around as like a thing. Well, you went to medical school before I did.
Yeah.
So, but because what actually happens when your heart weakens, it starts to try and stimulate itself and actually increases the amount of epinephrine in your body. And the beta blockers class of medication actually block that response and actually allow the heart to like heal and not overly like stimulate itself.
So it can actually get a good pump then, the way is what I would look at it is.
It helps to allow it to pump, but it allows it to pump both as a timing thing, but it also actually prevents toxicity from neuroendocrine stimulation with like catecholamines.
Oh, interesting.
If you want to get more technical.
Right.
Then there's a second group of medications called the ACE inhibitors, the ARBs, and then a newer class of medication called ARNIs, which is ACE receptor inhibitors, and then neprilysin inhibitors, which is a combination medication, which is used for people with weakened hearts. And that is a blood pressure medication. The main thing it does is actually dilates the heart artery or the arteries in your body in a way that takes stress off of your heart. But then that also interacts with the kidneys, actually interacts with like hormones in your lungs that actually dilate the arteries and sort of rest the heart as well. And so that those medications actually help potentially strengthen the heart if it's weakened. Then there's a class of medications called SGLT2 inhibitors. These were actually initially thought to be these great new diabetes medications. Mm-hmm. And essentially what they do is cause you to urinate about 300 calories worth of glucose every day. And so I thought, well, that's going to treat diabetes.
Right.
Interestingly, what it did, it does mildly treat diabetes. It's, a moderate medication for that. But, that's a different way of getting rid of fluid. And it's interesting because getting rid of the glucose in that way actually takes stress off of your kidneys and then prevents all that,
fluid accumulation.
Well, it prevents fluid accumulation, but also, affects your, kidney hormones and also your stimulation hormones. It causes reduction in your epinephrine levels, the same way, a little bit like the beta blockers do, which actually can cause, long term, can cause damage to the heart. And it's interesting that those actually are important for weakened hearts. They're actually the medications that show the earliest benefit when you actually start taking them in combination with the other medications.
Yeah. Great. And then what about diuretics?
So, not all diuretics are created equally. What are diuretics? Diuretics are medications that act on your kidneys and help you get rid of excess sodium. And, the way your body works is the water just sort of follows the salt out. Mm-hmm. And you can act on all different kinds of the, all different parts of the kidney. The most common diuretic are when we give people, especially acutely when they have heart failures, Lasix or furosemide. Mm-hmm. Or bumethidine or Bumex is another common one that we use for that. But there's actually another class of medication, a different kind of diuretic, aldactone, and I'm blanking on the
spironolactone.
Yeah, no, but
or the
what do you call that whole class? Because it's also the
potassium sparing. They're not
Mineral corticoids.
Yeah,
mineral
MRA agonist. That's what I was trying. Yeah.
Testing our knowledge here.
Yeah, testing my knowledge. Way to put me on the spot, guys.
Yes.
No, the MRA agonists, which the most common ones are spironolactone, Inspira, and then, it's not indicated for it yet, but Corindia is going to, is basically in that class of medication.
It's another great medicine.
Already having, preliminarily probably good heart failure data.
Yeah.
But don't quote me on that yet. More to come on that. But, that's a medication. These are kind of diuretics that the way they work. They also, aside from getting rid of the excess fluid, work on the kidney hormones in a way that reduces, stress on the body as a whole. Mm-hmm. And so, each of these classes of medication that I mentioned, actually makes you live longer if your heart is weakened. And that's how we've, come to using these as our mainstays of therapy. And interestingly, other kinds of diuretics, they get rid of extra fluid and make you acutely feel or breathe better, but they don't actually make you live any longer. So, we use those kind of in supplementation, with the other medications.
So treating acute heart failure versus chronic,
right,
that?
Yeah.
Okay.
And then, there's a fifth medication called Vercuvo, which is a newer heart failure medication for people that are unable to tolerate some of these other medications. I think, is it the sodium channel agonist? I'm blanking on that.
It's not one we use.
We don't know that one.
Yeah, it's not.
I was just going to say that one. Oh, interesting. I didn't know that.
Mm-hmm.
Yeah, that's a, sort of third line treatment. If you're not able to tolerate a beta blocker or a ACE inhibitor because your blood pressure is too low, or the other diuretics aren't working.
Right. Because those medications could cause dizziness or fatigue even, or if you're if you already have incontinence, that's not very pleasing to have to go to the bathroom all the time.
Right. So, any medication has its benefit, comes with its own whole set of side effects.
Right.
So, like I said, this is just another option, that some people who aren't able to tolerate the other medications, can use that as a backup option.
And then what about some of the non-pharmacologic options? Before you mentioned, heart transplant, that's at the extreme, right?
Well,
but before we get there,
that's really the end of the road.
Right, that's the end of the road. But what about before that? I've heard about this a vagal stimulator called Barostim.
So there is something that's come on the market probably in the last 2 or 3 years. It's a pacemaker-like device, that sits in the chest wall, then actually has a wire that connects to your carotid sinus. not science. So your carotid sinus, and actually stimulates that like some kind of rhythmic way that increases your vagal tone. Your vagal tone is part of your like autonomic nervous system, or part of the nervous system that your brain doesn't necessarily have control over. Mm-hmm. And so like when people pass out or have like syncope, which is another term for passing out, part of that, or one of the most common reasons that is called vasovagal syncope. Mm-hmm. And that's what happens when people can stimulate that autonomic system. Can make your blood pressure or heart rate drop suddenly. Can make you get a sinking feel in your stomach. Break out into a cold sweat. For that when you pass out from that. But we found that stimulating it at some sort of low level causes like dilation of the arteries and can potentially be beneficial for people with moderate like systolic heart failure. So if the heart's mildly weakened and for whatever reason either they're not responding well to medications, they don't want to take pills, that's at least a theoretical option. Mm-hmm. And that being said, it is like a surgery and implant. Granted, it's very sort of minor procedure, but still a procedure.
Exactly. And then there's also something called a life vest.
So, a life vest is something we use short term. Longer term, if your heart functions below 40%, if it's from heart attacks, 35 from other causes, one of your biggest risks of dying is dropping dead from irregular heart rhythms, because when your heart's weakened like that, there's typically scar tissue in there which you can form abnormal circuits, or can, for lack of a better way of saying it, screw up the electrical wiring or system of your heart.
Right.
And so there are two ways of dealing with that. The life vest is what we do in sort of a shorter term scenario. Say someone's had a big heart attack, their heart function's decreased, their biggest risk of dying in the next, after they've survived the heart attack, which, if we're talking about a life vest, I would presume they did.
Yeah.
But after they survive their heart attack, their biggest risk in the short term, aside from another heart attack, is heart arrhythmias. Mm-hmm. And so what a life vest is looks almost like a T-shirt. Then there's a second company has, which I don't recall the name of right now. It has almost like a bra-looking kind of device, and it's basically like EKG leads and then like a milder kind of small defibrillator. Okay. So if you suddenly develop one of these life-threatening irregular heart rhythms, it will basically shock your heart back to a normal rhythm and keep you from dropping dead.
Right. And so like an example, like I had a patient who did develop acute heart failure. They were in the hospital and they were discharged because they weren't quite sure yet the status, right? This was something they were trying to determine, is she going to need the next thing we're going to talk about, like AICD, right, which is implanted, mm-hmm. or is this something she can actually recover from, because they believe it was due to infection, right? But it was quite severe, so she left the hospital with the life vest, temporary, mm-hmm. and she had to wear that until her follow-up appointment.
Yeah, life vest, best way to think of life vest is like a safety net.
Right.
It's something, with any luck, you don't ever actually use.
Right.
But when you need it, you really need it. Because the other option would be dying.
Right. Yep. I'd rather have one than not, right?
Well, some people, it's not necessarily comfortable to wear it around.
Right.
The more you wear it, the more benefit you get from it. So the life vest is sort of short term, because once we've discovered you've had your heart's weakened for whatever reason, you've had a heart attack, it's weakened from an infection. We don't know if it's going to get better or worse with either one of those situations. Life vest is something you wear temporarily for 60 to 90 days, and checking intermittently to see if your heart is recovering or not.
Okay.
After 90 days, if your heart's not recovering and it's still weakened to that degree, then you move on to the next device, which is something called a defibrillator. Defibrillators basically a pacemaker-like device. It's a small canister that's implanted typically in the left chest wall, and then it actually has wires that go through the veins in your shoulder blade into your heart, and they can detect irregular heart rhythms. And if they detect it, will actually deliver a shock to your heart to put your heart back into a regular rhythm and again keep you from dying. And we've known that now for about the last 15 or 20 years that people whose hearts are weakened, get benefit and will live longer if they have this, because they won't drop dead from irregular heart rhythms. That being said, there is a time component to that as well. So at some point there are certain ages where you start thinking, well, what's the benefit of doing this if this is going to make you live 10 years instead of 7 or 8 years, and you're 95 years old? Is that something that is really for you? But that's a discussion to be had with your doctor, but just a consideration for those things. And then there are actually even fancier versions of the defibrillator where you have extra wires that go to your heart, because one of the things when your heart's weakened, typically a defibrillator will also have a pacemaker function as well, because as your heart's weakening, part of the sign of damage to your heart is damage to the electrical system. So the heart can either stop beating, not beat regularly, and so you can actually, you have these wires in there to prevent it from stopping beating. But as your heart expands or becomes bigger, pacemaker only typically has one wire that causes the heart to beat. If you think your heart is like a circle and you're just stimulating one spot, and then that's traveling around both sides of the circle, it's not necessarily uniform. And so if you actually stimulate the circle from opposite sides, it causes it to contract a little bit more uniformly, and so it can actually improve like your heart function. And so that's called a biventricular defibrillator, because you have two wires into the ventricle to help it contract more uniformly. Yeah.
Something I think is underutilized is cardiac rehab. Mm-hmm. Right? Cardiac rehab is a great tool for many things.
There's a lot of it. So, and as we kind of alluded to earlier, after you've identified some of these conditions, I very routinely will send my patients to cardiac rehab. Basically that's just a defined exercise program where you're working with trained like exercise physiologists who specialize in working with heart patients. You're also placed on a heart monitor while you're there, to make sure they're not over or under doing anything. And then like I said, as we kind of implied before, part of things that you can do as an individual to stay or maintain your health is to exercise or modify your lifestyle in a way, and this is sort of a springboard to help you learn how to do that.
Okay, and that's something that people do in the outpatient setting, right?
Correct. So that's typically.
Is it like physical therapy, but it's cardiac rehab?
Yeah, it's like a form of like physical therapy. It's just more directed for heart patients. It's like a little bit more cardio type of things as opposed to directed like physical therapy, like say if you're doing exercises for your back or a bad knee or things like this. This is sort of
specific to the heart.
Exercises for your heart.
For conditioning the heart, right?
Yeah, although you aren't doing like push-ups for your heart. But
But it helps bring their quality of life back from being, especially post-hospital stay. I mean, I feel like anytime anybody's in the hospital for a week or longer, I mean, they're fatigued for a while.
Yeah, well, I mean, the metric I use or tell people is that every day they're in the hospital, you're losing, you're laying there in bed, you're actually losing as much as 1% of your muscle mass just laying there, not doing anything. And it's typically going to take at least 3 days of concerted work to really build that back. So you're in the hospital for a week. It could take up to 3 to 4 weeks really to feel completely back to normal.
Exactly.
So, and that's, if you don't put in the effort to that, you're not going to feel normal. It's going to take even longer.
Absolutely. And then at what point do you, I guess, recommend the worst case scenario, like a heart transplant, right? Like, so you have all these other modalities. Is that a situation where it might be caught too late, or do these other modalities like expire, or what? How do you explain?
Yeah, it really depends. Like some people's hearts are just weaker or more damaged than other, and depending on the age, not to be an ageist, but again, at a certain point, the amount of benefit that you're getting from anything that you do has to be weighed over sort of how long you're expected to survive. Once you do have a diagnosis of severe heart failure, yes, does it definitely impacts or decreases your life expectancy. And if it's severely weakened, the question is how to figure out what that point is where, actually getting a new heart is going to benefit you. And I mean, quite honestly, that's not like a routine thing. There are actually transplant centers that specialize in this.
Gotcha.
And there are very specific ways you can actually measure sort of like how weakened, someone's heart is. Like you can do like a metabolic stress test where you're actually measuring like their VO2 max or how well their heart's able to, the body's able to utilize oxygen. And there are very specific like benchmarks where you're considered, above or below a threshold where you need to do something that extreme as to actually get a new heart.
Well, that makes sense.
Yep.
I mean, we like doing VO2 max for longevity and prevention, so that I could see how that could be measured for, specifically
Being
to
really
the heart.
sick.
Yes, being really sick. Well, I think this has been very informative, and thank you for coming on. I would love for you to be able to tell our audience how they can find you.
Okay, so I and my 6 other partners have an office here in Boca. The name of our practice is actually Bartsokas, Rubenstein, and Sarvas, MD. We're just across the street from the hospital, 1000 Northwest 9th Court. The phone number there is 561-368-4444. We do have a website, which was BSBRMD.com.
And I'll post all that in the show notes as well.
If you could put it in the notes, because clearly I don't
You're
know
too
how to
busy
get to our website.
seeing patients.
Well, I can't remember the last time I actually looked at my own website. So.
Right.
Well, thank you. Thank you for coming on with us today.
Hey, thanks for having me, guys. It's a lot of fun here. So hopefully you'll find some other topic that I guess I'm an expert on. And
There's a lot of them.
Right.
There's several we can do.